Hi, I'm Jody Tellis, and I'm one of the physical therapists here at Baton Rouge Rehab Hospital. And today I'm going to teach you about how to position patients in bed to prevent pressure injuries, maximize their comfort, and access to their environment. Pressure injury is defined as a wound that occurs when pressure on the skin causes decreased blood flow and oxygen to the tissues, resulting in rapid tissue death and damage to the layers even far below the skin surface. Even though most people think that these wounds are typically slow to develop, severe skin changes can occur in only a few hours if pressure is not correctly redistributed. Pressure injuries are most common in those who are unable to adequately reposition themselves due to injury or disability, have impaired sensation to detect pain or pressure, and/or are frequently incontinent. There is also a higher risk in patients who are significantly underweight, overweight or obese, have significant amount of edema, or impaired circulation. These injuries most frequently occur over bony prominences, most commonly over the heels and sacrum. Other high-risk areas include the back of the head, shoulder blades, elbows, spine, hip bones, knees, and ankle bones. When patients lie in positions that put pressure on these surfaces for an extended period of time, the bones can compress the capillaries and eventually lead to ischemia or reduction of blood flow in the blood vessels. It is also important to note that pressure injuries can develop anywhere on the patient's skin, especially if they are lying on an uneven surface or object in the bed, such as a phone charger cord, catheter tube, or even a wrinkled draw sheet. Always be sure to check the bed while repositioning your patient to remove any unwanted object or wrinkles in the bed linens. Also, frequently check your patient's clothing or orthotic devices to ensure that they are well-fitting and not secured too tightly to decrease the risk of pressure. When positioning a patient on their back, you ideally want the bed to be as flat as possible to minimize pressure on the sacrum. The head should be supported by a pillow, preferably only one to limit extreme neck flexion. Place the arms at the patient's side and support with pillows if needed to redistribute pressure away from the elbows and allow for elevation to assist with edema management. Always be sure to support the shoulder and scapula when raising and handling the arm. The legs should remain as straight as possible in a neutral pelvic position with the toes pointing upright. Place pillows or positioning wedges under the calves lengthwise to prevent excessive knee flexion, allow for elevation of the legs to reduce edema, and float the heels completely off the mattress. Always check that the feet are not in contact with the footboard and that any covers are untucked from the foot of the bed or removed from the feet entirely to reduce pressure on the toes. Some patients will need to utilize positioning or pressure-relieving boots that may have kickstands on the sides to assist in maintaining a neutral position of the legs and ankles to prevent joint contractures while also decreasing pressure to the heels. When positioning a patient onto their side, it is important to offload the sacrum while also protecting and supporting the extremities. Continue to utilize pillows and positioning wedges to support the patient in the desired position, improve patient comfort, and increase the likelihood that the patient will be able to remain in this position for the intended length of time. The bed should be kept as flat as possible and the head supported by 1 to 2 pillows. Before rolling a patient onto their side, assist them to scoot to the opposite side of the bed. If the patient has difficulty remaining on their side and continues to roll back onto their back, use a pillow or a positioning wedge to place it underneath the pad or draw sheet to support the patient in a side-lying position. Always double check that the positioning device does not come in contact with the sacrum. The legs can be positioned in either of the following 2 positions. Ideally, you would have the bottom leg bent and staggered in front of the top leg. Be sure to place a pillow under the top leg to fully float the heel. This position helps to decrease rotation and protect the trochanter and shoulder. However, if your patient continues to roll back in this position, instead bend the top leg and place in front of the bottom leg to allow gravity to assist your patient to maintain this position. Always ensure that the top heel is completely offloaded from the bed and that the ankles and knees are not in contact with each other. In this position, it is important to ensure that both arms are supported and positioned correctly to decrease risk of injury to the joints. The bottom arm should be supported into a slightly extended position by gently pulling forward the shoulder blade and keeping the arm flat on the bed. Always be sure to gently scoop the scapula, never pull or jerk the arm to reposition it. The top arm can be rested on a pillow in a comfortable position for the patient. It's important to understand that no one position is perfect for preventing pressure injuries. The key to protecting our patient's skin is to correctly position them initially, and then understand that we must correctly reposition them at a minimum of every 2 hours to completely offload the areas that have been sustaining pressure. I hope that this video has helped you to advance your clinical skills in correctly positioning your patients in bed. Be sure to check out our website at www.brrrehab.com and subscribe to our channel for more helpful videos and our Real Rehab Skills video series.